Welcome to the Home Health Minute, your monthly podcast brought to you by the Home Health section of the American Physical Therapy Association. Hosted by Troy Mead. Well, hey everybody, I'm here with Dee Kornetti of the Home Health section, the Home Health section president, and we were wanting to talk a little bit about CSM and how it went over and kind of the main themes with. First off, I'd like to say hello, Dee. How are you doing today?
I'm doing great, Troy, and it was great to meet you in DC this year.
I know it was great to finally see everybody that I've been talking with on Skype, Zoom, Twitter, all that fun stuff. To finally actually meet you all in person. You're actually real people, so that was nice. How did CSM go for you?
Besides it being way too cold for a Florida girl, it was great. It always seems like there's a great buildup to CSM for me as the section president. And then when I get there, it's just a mad flurry of education and catching up with people and updates from APTA and a lot of things happening during the programming, but also in the meetings and the collaborations and, the activities that happen in and around such a conference. So I'm always excited by it. But then, when you kind of let the snow globe effect, the dust settle, all the snow settle in it. It's been about a week. I feel like I've re-entered the real world after being embedded in an APTA culture for a whole week. Great things have emerged, and I'm very hopeful for the profession and for the practice of physical therapy in the home health industry moving forward. I think we're taking great steps.
Yeah, there was definitely a lot going on. A lot of discussion about where we are, where we're going, but I think a lot of enthusiasm about where we're going. You know what I mean? Which you don't see with PDGM and everything kind of on the forefront of everybody's mind. You don't see a lot of enthusiasm. I was encouraged by that.
Yeah, it wasn't a doom and gloom by any stretch. And, the key things for me that kept coming through every session that I sat in on, everybody that I talked to in a post-acute, mindset was the value of our services. And I don't think there was any better session than one of the most popular that we always see at CSM for the home health section is the hot topics. That usually goes off the 11 to 1 session on the first day of the main conference, which was Thursday. And we had great opportunity to hear about, what the model looks like from Cindy Kraft, and then, our value and the role of therapy in bundled payment care initiatives from Dan Kevorkian, who spends his time in his day job lending his expertise and building those partnerships, to Jason Falvey, who does home health very specific related research and is one of those unique researchers that actually has practice in home health. So he translates the data into what it means in real life for the practicing clinician. And the prognosis for therapy in post-acute is good. It's healthy. People want to be in their home. It's the most cost-effective setting. And the data says physical therapy in the home is instrumental in affecting rehospitalization risk and dealing with those hospital-associated deconditioning and those other events that can happen. And so I think the data is just going to start coming forward as throughout this year. And I'm really hoping that practicing clinicians, section members, APTA members really get on board with translating what we do, how we build care plans, what interventions we choose. Sure, evidence-based, I'm all about that. Follow the regs, conditions of participation, but more importantly, speak to your value. Right? What are you doing to reduce rehospitalization? And so we had so many sessions related to advocacy, value-based purchasing, the value of home health physical therapy, learning about the OASIS, specifics about depression, dementia, treating geriatrics. So many really, really good sessions that were really geared to take the practice of what we all know how to do and raise it to that next level. So I was excited. Good programming, always pulled together great by our section chair, Aaron Pazor.
Yeah, Aaron did a great job. Like you said, a lot of variety, but overall, a main theme, I think. And especially with Jason, one of the big takeaways, I took away from his talks, because he talked a little bit in hot topics as well as other sessions,
Mm-hmm.
but about telling our own, we have to tell our own story. Otherwise, other people are going to tell our story, pretty much. That's paraphrasing. I can't say it as elegantly as he does, but that's one of the big takeaways I kind of got as well.
Yeah, and it's a great call to action. Know what the data, what your treatments, what the patients you see, what your own dashboard is in your agency. This robust real-time analytics is available. And honestly, the CMS is pulling that information and they're interpreting your data. And I agree with Jason. We need to be at the table. We need to know what our numbers say. We need to know where we win with patients and what our value is. And so I think he did a great job of bringing it down to the day-to-day therapist. This is how it impacts you.
And to speak to that too, we had some special guests at some of the sessions as well. Is that correct?
Yeah, actually on the first day, Thursday, the first two sessions, the Finding Your Voice that was facilitated or hosted by Megan Valenzano, a section member, who is also her day job. She works at Fox Rehab and is in charge of their regulatory and government affairs. We had, as well as the hot topics, that Cindy platform, that platform of speakers. We had invited Hillary Loeffler, who is in charge of the home health division at CMS, and literally is responsible for writing the home health rule. So that's great. We also had a colleague of hers, Jim Cower, who is a physical therapist, but is under the quality initiatives and does a lot with the interpretive guidelines and the conditions of participation. So he's integral in those documents being developed and interpreted. And we also had a good friend of the section who's spoken in the past at Precon on leadership, and who I've had the opportunity to meet several times, is Dr. Harry Feliciano. He is the Chief Medical Director for the Medicare intermediary Palmetto GBA that serves, I think, 16 states. So they were thrilled to be in attendance. They had the opportunity to speak. I think they got a really good look at how we see ourselves as part of the solution, not part of the problem. In what is going on in home care. And more importantly, just as a follow-up, Hillary has requested the slides from the Hot Topics section, and Cindy was so kind to send those to her, and she said that that was probably one of the best sessions and most informative sessions she's heard in a long time. And so we hope to see them back next year at CSM in Denver. And so the section is going to take the steps to try to get them on a panel or have them present and be involved as we look to interpret PDGM and put dollar signs to it next year. So I think it's just going to be another great year to engage with the industry and the decision makers as valuable stakeholders. That's what I see our role. I think that came out loud and clear as we engaged with the industry, if only those two sessions.
That's a great leeway into, okay, so what's the future look for the section for CSM next year? What's your summary of how, we've already kind of went through the summary of how it is now, I guess, but anything you want to add, and then what's the future looking like?
Well, I think, one of the things I think we need to continue to support in the section, and it was a big decision in my choosing to run, and thank you to the membership for reelecting me for another 3-year term, which I started immediately after the completion of CSM this year, is to see us through to that unified payer system that we're going to expect to see in all of post-acute 2020 and beyond. And so I think we have to live in the present, but we have to keep our eyes to the future as far as understanding the role of data and what data means. And I don't want to underestimate what we put out in the publications, the case studies that come through, the work that Dawn, our Dawn Greaves, our new publication chair, talks about, the information that you and the rest of the social media and public relations committee with Dr. Caruth and Sean Hagee and Sherry Teague put out through Facebook and Twitter, and most importantly, what we do in research, how we have this opportunity to have platforms and poster presentations. I want to keep encouraging people that are practicing, as well as people going back to school and current students, to get involved in speaking to the data and what the value of therapy is. I think that's going to be integral every day from this day forward, to help to have a voice at the table in the decisioning for how payment models are going to be set up. Moving forward, looking at the APTA and us falling, if you will, under that mothership, I think it's critically important that we start to adopt that same frame of reference. APTA, I don't know how many people know this, but should be following it, has broken ground on their new home in Potomac Yard, which is not very far from where the APTA offices are located now, but they've really taken a lot of strain and pride and emphasis, and really a lot of work put towards making that a building that looks outward, a building that speaks to movement and speaks to us being part of the solution, right? And so their use of materials, we have the opportunity as component leaders to hear from the architect and how they're structuring the space and what materials they're using. And I think that that's an important concept, is that outward looking. We have to realize, as members of a profession, that we are strong together, but we also have to coordinate and collaborate with the industry in which we work. And so over these next 3 years, it's a big focus of mine as the president, to look towards collaboration in the industry with state home care associations, with the National Association of Home Care and Hospice, with payers that are in the post-acute space, because we have to establish ourselves as the place for all things physical therapy related to home care. And so that requires us to strengthen our numbers internally within APTA and continue to seek membership and support and involvement of all the experts that we have, in our group. But we also have to look outward, and we have to be present and visible and a voice at the table in the industry. And so NAC has this PDGM roadshow that's going on in 10 or 12 states. I encourage you to take the opportunity and to go hear these speakers. We are blessed that one of our members and our past president, Cindy Kraft, has now been appointed to the NAC Education Committee, and so we should start to see that influence of therapy moving forward, a little bit more specific to our industry in some of their education. But in the meantime, don't shy away from attending your state home care and your state therapy association meetings. Get involved, have a voice, collaborate with other people in post-acute, offer to speak at these sessions, stand up and volunteer, and don't ever miss these open comment periods, which Carol Zaneker and Kara Gaynor at APTA, Carol as our government affairs chair, speaks about, these open comment periods, so that we can put our 2 cents in. We can talk about how these decisions in regulatory and government rules and are really going to affect our patients. I think that that's critical. So keep educating ourselves within, seek to attend CSM 2020 in Denver, and look to collaborate outside. Look to those peers, look to those other stakeholders in the industry, and get involved. It's always important that we be the resource to talk about all the value and all we do for our patients to keep them out of the hospital or higher cost centers in a home care setting. So that's a pretty aggressive agenda and a big long run-on sentence, Troy. So I hope I didn't run us out of time, but it's inward looking, but in collaboration and alongside APTA, it's all outward looking. What can we do to start to really have that impact? It's great when we affect a patient, in the house on that day that we treat them, but we've got to start to influence the industry.
Yeah, that's a great summary, and it's looking like it's a bright future for us, especially for collaboration in the way things are going.
I think so. I mean, you have your choices. You could look at it as half full or half empty. And I'm saying that we're half full. We're going with the optimistic. The sky is the limit. Get involved, speak up, volunteer. If you have not volunteered for the section, I think that's how you came across us. You were tweeting somewhere and we're like, oh, grab Troy. But I mean, you want to tackle or tap into people's passions, and what they feel engaged about. And we all feel engaged about our patients. And so use that as the impetus to get involved, to have your voice heard, to write a comment during the open comment periods, to get involved in the forums, and to become educated in the industry in which you provide care. There's no one better prepared than today's physical therapist and the physical therapist that graduated years ago with me, right? And have the experience to really, to verbalize our value to the older homebound population.
Well, I appreciate your time, and I look forward to 3 more years of leadership underneath you.
Oh, thank you, Troy. And I look forward to seeing you every CSM. And thank you. A big shout out to all the work that the Public Relations Committee did to show up at our sessions, to get tweets, to get some videos of what was going on. You guys do a great job. So kudos to you and thanks for everything.
Well, thank you. I appreciate it.
Thank you for listening to the Home Health Minute, the podcast from the Home Health section of the American Physical Therapy Association. Check out our website at www.homehealthsection.org. There you can find links to this episode, tons of helpful resources for your practice, and how to connect with us on social media. Thanks for joining us, and we'll see you next time.